For those who've been navigating the realities of mental illness, you should know that there is still room at the table for you. There is nothing that you've done, no burden that you carry that will rescind this grand and great invitation.
People who have a mental illness deserve respect, to be seen as people. And when you start there, you give them the hope their lives can be different.
I do see some kind of more of a dialogue between the medical community and the criminal justice system. Educating judges, we can learn as much from the other side as they can learn from us.
We are honored to be able to partner with the New Jersey Reentry Program to have a healthcare provider have access to those coming into the program, giving them a great health assessment and referrals back out to physicians, provide them with the appropriate screenings that are needed.
We started out with a model where we had a plainclothes officer in an unmarked car arriving to a scene of mental health or emotional distress cases with a mental health professional. We've had no injuries to the officers or to the individuals. We've essentially had no uses of force.
The way that the laws are written prevents sometimes the mental health providers from getting involved, even though the entire family knows there's a mental health challenge going on. That provider can't actually get involved until that person acts in a violent way.
Too often, people are being diagnosed for the first time behind the wall. We're already behind the ball once somebody gets behind the wall.
And because of those systems being fragmented, our inability to sort of join these systems prevents us from allowing those tools to reach their potential. So I think we have to understand that everything is connected, that ability to share information across symptoms, but that real underlying understanding of the person is really the key to this.
When I got back from my last deployment in 2012, I didn't wait to feel the symptoms. I immediately made a mental health appointment, get the maintenance care, because it's just an injury. It's not a disorder.
There's a path, there's a solution. It's not going to be easy. It may be a lifelong process, but there's a life where you can just take a deep breath and enjoy your experience.
Making sure that people get the mental health they deserve and that they need is just good public policy.
Let us look toward a future where mental health is not stigmatized or criminalized, but instead treated with compassion and understanding.